like it's in my head, and it's kind of scary. Anybody in my head's got to be scared. Come on in. Come back to me. So we're going to talk about how trauma affects the body, and we actually talked about this the first time that I talked, but we're going to talk more clinical about it. Does that make sense? So the next slide, which is I'm going to talk about the autonomic nervous system. And so technically it's our muscles and our glands and our internal organs. So you have an autonomic nervous system, and I'm going to show you a picture of how it looks. And in that system, there's a sympathetic and a parasympathetic system, subsystem. Your sympathetic is the flight, fight, freeze, and somebody added faint, so I just put it up there. And your parasympathetic is rest and digest. So does everybody have that? Because you got to have this for me to move on. Does that make sense? So you got your fight, flight, or freeze, and then you got your other system, which tells you to rest. So when I'm in my fight, flight, or freeze mode, my other system will come in when the danger's gone and say, okay, it's time to relax. It's time to take it down a little bit. So they work together. Mm-hmm. So when we go to the next screen, that's what your autonomic system affects in your body. So you see all the organs that it affects. You can't see the names of them, but you see the person's body. So every time we go from fight, flight, or freeze to rest, that's what's being affected. Your lungs, your heart, your eyes, just about everything in our body that has neurological connotations to it. Make sense? So if we go to our next screen, this is what it does. So you want to have a homeostatic system going, and that's your seesaw. You want it to be balanced, where you see the arrow. So you don't want your parasympathetic to be always acting, and you don't want your sympathetic to be always acting. You want it to relate to each other. Yep. If you're stuck like this, that means your fight, flight, or freeze mode is on all the time. Your other mode is not kicking in to tell you, okay, it's okay, the danger's gone, relax. You're always walking around like this. So you're always walking around expecting something. Sometimes people can get stuck in the rest and digest section where they don't want to do anything. I don't want to get up. I don't want to be bothered. And some people say, well, you're depressed. Well, no, depression's a whole nother thing. We're just talking about this system. Because remember, this is neurological. It's affecting parts of your body.
So trauma can affect, you can be in a traumatic state, being in too much rest and digestion? Does that make sense?
Well, yeah, it makes sense. Okay. Well, your reaction can put you in a parasympathetic state. So I can be a frozen in a fight, or freeze mode, or depending on how you process, I could be in I don't want to do anything, period. I just want to stay here, I don't want to be bothered, I want to chill down all the time, and that's not healthy either. A lot of times when our systems aren't working, we'll bounce back and forth in the extreme to either one of them. And not be in a homeostatic state. So this is a diagram of what it looks like and how we can bounce from one to the other. Most of the time we're in the sympathetic state. We're walking around like this, always waiting for something to happen. So this is the state that we can be in, and you want the dynamic balance between the two, but a lot of times we don't have it. So if you go to the next slide. So this tells us what it looks like to be stuck or locked on. Increased heart rate, anxiety, hypervigilance, mania, chronic pain. You can read what it says. A lot of my bipolars get stuck over here. And but bipolars, when you have bipolar disorder 1, 2, or 3, one is what I call the extreme bipolar, where when you go from one stage to the other, it's way extreme. Your mania is like I had a client who, when she's in her manic stage, she has no money, but she goes and takes her credit cards and she buys all this stuff that she doesn't need. And she'll tell me, but I felt like I felt like I needed it. I had to have it. And she'll come in with all these bags. And she's learned, when I work with her, to bring all her purchases to me, and I make her take them back. Because she'll eventually go back down to her depressed mode. Right now, she's pretty balanced. We've got her meds going, and therapy has gotten her into a pretty balanced mode. But that could change. I've had her balanced, and she'd come back after being in Las Vegas or something, and she'll have all these bags. And so that's what life is. It's not that I'm going to be perfect all the time, but I learn how to deal with my issues. And it's not always going to be perfect. You know, there are times when I have dealt with my mother, and I'm good. But there are times when I break down. And when she's doing ugly things to me, I completely break down, and it affects me in a very profound way. Does that mean I'm a bad person and I haven't learned anything? No. It means that that's how life is. You know, life is variable. Sometimes we're doing good, we got it going on, and sometimes it's not. But the whole key is for me to notice when I'm in that broken state, so broken that I need to take some time for myself. I'm visiting with the Lewises, and this is supposed to be a restful time for me. But it's restful for me to talk to people. I like talking to people, and I like visiting with my friend. I haven't seen Lance and Sharon in their territory. It's been a long time. We were at LDR last year together, and it really kind of restirred that, you know, they're part of my tribe. Amen. So that's the reason why I came out, because I wanted to visit with them and talk to you all, because this is part of my therapy. This is what I do, and I love doing it. So you get the understanding of how this works. So this is the stuck in the sympathetic system. If we go to the next slide, this is stuck in the parasympathetic. So you decreased heart rate, emotional numbness, depression, low blood pressure. Does anybody know what disassociation is? Go ahead.
It's when you kind of feel like out of body and you're no longer like connecting with what's real, like in front of you.
I call it your way of checking out. I'll have clients that have been sexually abused who will tell me, I know this happened to me, but it was like I saw myself through a window and I was looking at somebody else. And so in my head, I checked out. While my body was being abused, my head, I went somewhere else. And so somebody said to me, well, isn't that a good place to be? And yeah, because it's our body's way of helping us survive. But if you stay there all the time, that's not good. You can't check out all the time. And so my trauma people that have been sexually abused, a lot of times will disassociate in anything that challenges them. And that's not good. So, go ahead.
So if you have a tendency to do that, how do you work through the history if you have a hard time remembering it because you forgot?
Some of the stuff that we talked a little bit about before, like the EMDR, that's a way of going back into your head and getting you to bring it forward. Go ahead, Sarah.
Is it possible that sometimes you might be in a sympathetic state one part of the day and then you end up in the parasympathetic state?
Oh, most definitely.
You know, a few hours later.
Yeah.
That happens to me when I run out of adrenaline. When I no longer sustain the high.
There you go. You can't help it. Your body has exhausted what it's shot out to you. And so you're sucking it up, and then you just have nothing. And that's when you go to this part where I don't have anything. I'm numb. I want to just check out, and everything in your body responds, because remember, it's responding to what's going on in your life. Disassociation is huge with people that have been through trauma, because a lot of people that in varying types of trauma will learn to disassociate, and I'm working with them, training them that you can't check out every time something challenges you. You have to stay in the moment, depending on the challenge. And it's like all therapy, you're working with people all the time. We're working. They'll come to me and tell me that I was great last week, but this week, man, I stayed in my checked out mode. And so it's just walking with people, working with them as they're learning. I always take my clients back historically. Everybody doesn't like that. Some of my clients will say, if you're going to talk about my history, then I'm not coming to you anymore. And I said, that's good, because that's what I do. And if you're not ready to walk backwards so you can walk forwards, then you probably don't want me as your therapist. And so there are therapists that don't deal with any of your history. They deal with the here and now. brief counseling, and that's fine if that's what you want, if that's what you feel like you need. But most all of my clients have been through severe trauma, and they need to go back and visit with it so they can process it and move forward. Does that make sense?
It seems like you're just dealing with the surface if you don't go back far enough. You don't get down to the root.
I totally agree.
Yeah.
But remember, there are people that can't deal with the root.
Oh, that's true.
Yeah. Go ahead.
That was going to be my question. My children were in orphanages for the first 5.5 and 7 years, so they don't remember. You know, so trying to take them back, they really don't have memories.
So
How do you deal with that?
they really do. I had a client who told me she remembered none of her. She was severely sexually abused by family members from birth on. I wouldn't take her back. That's when you have to trust your therapist. That I knew that if I did, I would do more damage. So I started later on with her. Taking her back to things that she didn't remember when she was really, really young would not have been helpful in any way. Taking her a little forward to her adolescence and stuff was a better place to start. And so that's what I did. Some people cannot, we can screw people up if we go too far back and they're not ready, because there's stuff back there that surfaces that you never knew about, and you don't know how you're going to process that.
And the scriptures say that there's deliverance. We just don't tap into that. Confess your faults to one another, and you'll be delivered. And
True
that's
that.
basically what we're doing when we come to counselors. We'll confess, hey, this is not fault like it's your fault, but faults like weaknesses and wounds, and those are things that we're carrying because we haven't been good.
Right, and a lot of that stuff is not our fault. Go ahead.
I listened to a lecture by Diane Reinberg, and she was saying that sometimes, she doesn't go back if the person doesn't want to go back in the past.
Exactly.
Because they're not going to go there, so she'd rather have them be productive where they're at right now.
Right.
And so if they don't want to go back, you can't force them back.
That's true. And you do more damage if you try to do that. And when I assess people, that's part of what we do. I'm assessing people, everybody that comes to me, and there are times when I know it's not a good fit, and I'll tell the person. I can see already that we're not going to be a good fit, and the person will usually say, yeah. I don't get offended by it, and I'll recommend somebody else for them because we're not going to be a good fit. The way I do therapy is not like everybody else, and so I am different in therapy. That's why when you go to my website, I explain how my therapy works, so you're not clueless when you come and see me. So everybody doesn't fit with everybody. That's why I tell people you have to look for a good therapist. And like Sarah was telling us, when you don't make any money, you don't have that luxury. A lot of times you go to whoever they tell you to go to. You don't have any other choice. And so you have to deal in that arena with what you're dealing with. Any other questions? Nope. So, let's talk about ACEs. This is my favorite. Adverse childhood experiences. And we talked a little bit about this earlier. And you can go to the next slide. What's the wonderful thing about ACEs was that as a therapeutic community, clinicians, we didn't have any bars to use. Does that make sense? So when people came to us and they were traumatized and stuff, we dealt with it in the way we do, but we didn't have these bars that say, if you went through this trauma, that trauma, the other trauma, your likelihood of being this way is exponentially higher. And when they did this study, it was wonderful for me and most all therapists that are in our field, because then we had these bars to use where we could say and work with our clients, have you ever heard of ACEs, adverse childhood experiences? And do you know how that affects you? And so you can see up here, this is where it came from. The race is the percentages of ethnicity. Now, I'm not happy about it because to me it's not cultural enough. It's not diverse enough. But I still took what I had to work with. And then you see the ages at the bottom, the percentages in the ages. And that could be a little more diverse, but it's pretty spread out. You have a lot of let's see, 46%, 60 plus, 20%, 50 to 59, 19%. I think it's kind of diverse there, except it looks like the 30s are kind of missing out a little bit. But this is where ACEs came from. And what ACEs did, it gave us 10 determining factors of adverse childhood experiences, that if people have experienced one of these 10 or multiples of the 10, their likelihood of having alcoholism, suicide ideation, suicide attempts, all these things were exponentially higher. So usually if you have 4 or more ACEs scores or cards, I have the little cards I can show you here. That means that exponentially your ability to have alcoholism, suicide ideation, suicidal goes up substantially. And I'm not naming off all of the, so the ones that you could find listed are on this paper. It tells you at the bottom what the impact of having childhood, bad childhood experiences are. You go to the top and it'll talk about the prevalence, and the bottom tells you how much more likely you are to experience certain things if you had adverse childhood experiences. Does that make sense? Like when I go through the ACEs cards, I'm a 4 score because my mother was verbally, emotionally abusive. Both of my parents were alcoholic. I forget all my cards, but I pulled 4 cards out of there. And I know that if I hadn't been working on myself and continue to do so, I could be alcoholic, or I could be an abuser of some kind of substance, because it's all throughout my family. And addiction does not just take on alcohol and drugs. We can be addicted to a whole lot of things. I have clients that are sex addicts. I have clients that are food addicts. I mean, it covers the gambit, you know. So when I talk addiction, I'm not just talking alcohol. I'm talking whatever you choose to be addicted to. So 3 categories and 10 types. So this is how ACEs is broken down: abuse, household challenges, neglect. And you see how under abuse, emotional, physical, sexual, household challenges, domestic violence, substance abuse, mental illness, separation, divorce, incarceration, and neglect, emotional and physical. Sarah, you were talking about your friends experienced some things that she thought wasn't on here, but I really think it might have fallen under the neglect category. So if we move past this to the next slide, you see this is what increases when your ACEs scores go up. Notice how a lot of this stuff has to do with your body. Just pay attention to that, because obesity, diabetes, stroke, cancer, they all are tied to your adverse childhood experiences. And people are having a hard time believing this, but this is very true. It is very true. And I try to educate people, because when we become educated and knowledgeable, we have a way of turning things around for ourselves. Once we know how it affects us and how it affects our bodies. So if we go to the next one, this is a triangle of the whole ACEs thing. So, you know, at the top is death, at the bottom is conception. And so you have adverse childhood experiences, and you see how it affects you in a negative way going all the way up to the top, leading to early death, which means that if I don't get my act together and take care of my stuff, I could die early. Do I want to die early? So this has a lot to do becoming aware of where you are in this whole process. It was mind-boggling to me when I started studying ACEs scores, because I was checking off all these boxes for myself, and I'm like, oh my God. I mean, if I don't get my act together and keep it together and work on myself, I could end up dying early. And I tell you, in my family, on average, my grandmother, my great-grandmother died at 40-something. My grandmother died at 62. My grandfather died at 64. And so when I do, I forget the name of the diagram that I do, where you put your family genogram? Yeah, genogram. I do genograms for a lot of my clients. And I go up as many generations as you allow me to, but I don't just do medical genograms, I do emotional, behavioral, health genograms, where, you know, we talk about, did you know whether your mother was sexually abused? Do you know whether your mother was verbally abusive? Do you know if your grandmother was an alcoholic? So I put all these lines in so that people can see and relate to where they find themselves today. It's amazing historically in our families how we can see this stuff genetically plays down generation to our generation. And it's pretty startling. I mean, I did mine. I was blown away by that. Go ahead.
Would you call that generational trauma?
Oh, definitely.
And that's a real thing, right? 'Cause some people are
No, that's a real thing. If nobody breaks the cycle, it doesn't get broken. It just keeps going. In the families where I tell you, where Uncle John and Grandpapa blah blah are abusing, that keeps getting handed down generation to generation because nobody stops it. So if I'm abused, I become an abuser. Do I have to? No, but a lot of times I do because of what I grew up around.
So yeah, I was talking to you saying that the Nazi, the Jewish coming out of concentration camps, they were actually finding that they had generational trauma, like in the third generation. So they were saying, the person was saying was that in America, a lot of people of color have generational trauma. That,
Oh, definitely.
They're dealing with, and that people are telling them, it didn't happen to you, get over it. It's like, yeah, this is generationally passed down. I can't, it's not like so.
That's why some things are systemic and endemic built into our society and into our cultures and into our families. And the only way that that stops is if somebody says, hold up, stop it, we're going to change this, and we're going to change the thinking, and I don't want to think like this anymore, and I don't want my kids thinking like this. And so we may be the catalyst that starts it, but if nobody ever steps up to the plate, it never gets changed. Go ahead.
It really does give an easy to like the sense of the fathers, because I think people do that deliberately, like, oh, this person committed this sin, and so now I commit that sin, and that's not necessarily true. It's this person had these toxic dynamics in their life,
Exactly.
and now I have them, and if I don't fix them, my children are going to have them, and it just keeps going and going and being passed on. And those are the sins, just because I may not be an alcoholic, like, if I had an alcoholic parent, I might have those same dynamics in my life that I pass down to my children, in a different form. And if I don't feel like that, their children might get it too. So those things
Exactly.
will pass down just in a different
Just
way.
because I'm not alcoholic doesn't mean I'm not addicted to something. And that's the whole point. People come to me, well, I'm not alcoholic. But then when I dig a little deeper, well, no, you're not alcoholic, but you're addicted to this thing over here. And so we just switch up. When I'm working with and that's not my strong area, is addictions. But when I'm working with addicts, I co-lead a couple of groups. They'll say, oh, Miss Michele, I've been clean for 6 months. And if I talk to them, they've replaced it with something else. I'm now smoking profusely, or I'm drinking tons of coffee, or I drink those
Energy drinks.
Yes, I have several young people that are addicted to those things, and they're toxic, more so than, and so then they get mad at me, and they'll say, I was like, look, this is not about me. I'm just bringing to you what I see. So you gave up this, but you picked up that, and it's excessive that you picked it up. And so that's the knowledge of, I know this now, what am I going to do about it? Or not. You may choose not to do anything about it at all. So we can go to the next screen. Okay, loss, grief, and mourning. You can move to the next screen. So I want to tell you that loss can be a traumatic event. I don't really distinguish between the two. Like people say trauma and losses. To me, it's all trauma. Loss is just another avenue where you're in a traumatic experience. That's the way I look at it. If I lose my partner, if I lose my child, if I lose someone that is very dear to me, that traumatizes me. And not only do I have the loss of that, it changes how I live, breathe, everything. And I was giving you my story. For a while, I didn't even realize how deeply I was affected by the loss of my son, even though I knew it was a traumatic event. And so it took me a while to process through that. But I got lost in that process because all I wanted to do is stop the pain. He's gone, I can't stay here, let me go back to work. And just plow into my work and not really deal with the loss of my son. But then, God in his wisdom, he'll bring us front and center to our stuff. And I realized in all the pain I had to deal with it. And that's why I look at grief and loss as trauma, because that's how they affect you. So what's the difference between the two? You see up there, mourning is actually the expression of grief. So I'm grieving, but mourning is where I express the grief. You know, through I would cry. I'm a big crier. I cry with my clients. They start crying, I start crying. But I would be I was still working for justice at the time, and I would be on the subway and see a young man that looked like David, and I'd start crying. And people would move away from me. I'd be like, dude, move over, there's something wrong with this lady. But they're not nurturing you, they're running from you, because we always have in our heads that you're weird because you're not doing what everybody else is doing. I never let that affect me. If I needed to cry, I would cry. Sometimes very kind women would walk up to me and put their hand on my shoulder, and I appreciated that. But don't tell me not to do something that I feel I need to do. I'm not hurting anyone, and I needed to do it for myself at the time. I still do that today. If I see a little boy that looks like David, I start crying. Or a young man that looks like him, I cry with my son, my youngest son, because he still misses his brother. So that's you know, this thing about you can't cry in front of people, I don't know. I tell my male clients, you can cry in here if you want to. There's no judgment here. If you feel like you need to cry, then you cry. Because, you know, we always tell men they're supposed to suck it up and be tough. So this is the grief mourning thing, and there was somebody put that on Facebook. I thought it was really neat. I forgot where it was that this sculpture was done, but it was perfect to me because he's empty. His whole middle is missing. Because that's how you feel. You feel like you lost yourself when you lose people that you love. And you look, what do you see when you see that guy? Some words.
Despair.
That's the thing that came front and center. Sadness, despair, being overwhelmed. I mean, he is the perfect example of that, of what grief and mourning look like. Does grief affect other people? Sure it does. Everybody that came around me when my son died was affected. I wasn't connecting with anybody. And so, yeah, it affected my youngest son because there was a moment that I told him, I don't have anything for you. And he was grieving too. We were all grieving. And so I had to do that at the time because I didn't have anything for anybody else. So you have to give yourself permission sometimes that you just can't be there. I'm the strong one in my family, so everybody comes running to me. I had nothing for anybody at that time. And they didn't like it, but too bad. You know, this is how it is. But I had to get my act together pretty quickly or I would have lost my youngest son because he profoundly was affected by his brother's death and he wanted to die. So I had to, God was like, wake up, get yourself together. So I started going with him to counseling and walking through, which helped me too, walking through the grief with him. Did you have any questions on this part? Nope. You can go to the next screen, next slide. So there's this acronym called TEAR, which I share with a lot of people on the task of grief, because sometimes you know, when you're grieving, you just want to stay in it. And you have to accept that your loss is real. Experience the pain of your loss. And some of this is like, really? Seriously? And that pain, that intense pain that I could never tell anyone how bad it felt to lose my son. I didn't have words to describe how I was hit with it, just the intensity of the pain that I was experiencing. And you can't draw a picture for somebody of how that looks. You just know that it goes beyond anything that you can figure out. So, but you have to adjust to your world without the person. You know, over time, I had to say, David's not here anymore. You know, and just work myself into that, keep his pictures up all over the place, but not get lost in the grief. I minister to women that have lost children, and some of the women have been lost in their grief where they lost their child and they were never able to get back to regular life. So let's be clear, life is never going to be the same as it was before. But you need to be functional in your life. And these women, I had a woman that had her son's t-shirt on. He'd been dead for 15 years. She never took the t-shirt off. She would take a bath in it. And so I needed to help her because she was stuck. And when I wasn't around her for an extremely long time, but she said, I thank you for just giving me the beginnings that I needed to get myself unstuck. So in that, there is no time frame for grief, but what we do know, there's something called complicated grief in DSM-5. And after a certain period of time, the DSM-5 says, you should be moving on to certain stages. And when I find people that are stuck in grief, I usually will diagnose with complicated grief and just process them through that. Any questions? So grief is not a disorder, a disease, or a sign of weakness. It's an emotional, physical, and spiritual necessity. We have to grieve. What would it be like if we didn't grieve? Seriously, if somebody died and you just, let's go on the next day, no grief, no mourning, you have to grieve because it's in you. Somebody that we love is gone. And even though we know we're told, one of the very annoying things, that they're going on to a better place, I think it's great. I know they're going, I still miss them here on earth with me. I still miss seeing their face every day. I still miss the experience with them. And that doesn't get dulled because I know that God is awesome and that I'm going to see him at some point. And so I walk with people through that biblically. The only cure for grief is to grieve. And although people don't want to hear that, that's the truth. You have to push through the pain. I'm supposed to write a book, supposed to write a couple of books, which I haven't gotten around to yet. I know I am because God has told me. But one of the books, I already know the title, is called Gradual Grief because I know what I went through when my son passed. And I had to go through those stages. I never forget, I was talking to my son. He's like, it's like somebody shot your heart out of your chest. I was like, well, for me, it's like somebody shot something through my heart. And I just was bleeding uncontrollably. And very slowly over time, it healed up, but there's still a hole there. But God has taught me to move on past the hole, but the hole is still there. I still lost something for me, but it made me, I can tell you, it made me a stronger person. I always think about my son. My son used to always say, I would say, I want a bigger kitchen. He'd be like, Mom, you work, you make money, buy another house. and he'd say it so matter-of-factly, and he was like my voice of, get on with your life. And so that's when I got my act together, that's what I did. I went on to, I said, David would want me to get my master's degree. Because he would say, go get your master's degree, Mom. He wouldn't go to school, but he would tell me to go. And so that's what has motivated me to keep moving and to help my other son to keep moving on because of that. And there's no timeline for grief, but I will tell you that I know when people are stuck. I know when people are stuck. And I kick in, but I don't tell them, you've been grieving too long. Those are hurtful things. Get your life together. You've been doing this too long. I go from a therapeutic way of explaining to them where they might and should be at this point in time. Does it make sense? Yep, Sarah?
I have a question about that. What about people who actually just, they can't grieve? They, for whatever reason, something happened that is so traumatic that they have not grieved, and years go by and they still have not dealt with their loss.
It's like I do trauma. I walk them back through it. And I ask them, are they ready? Because really, some people, like you said before, some people are not ready. It could be years and years, but if you're not ready in your head and you are like, I don't care what you say, I am not, there's nothing I can do. But when people are listening to me and active in therapy, I'll say, we really need to open this door up. And we'll go through it very slowly to open the door back up. Yeah. Because you can't go through that and just lock the door and I'm just not going to deal with that. Because it's going to come out anyway in very toxic ways. Did you have something, Sarah?
Yeah, I was just going to say that I love that the scriptures say that Jesus wept, because I think it really teaches us that even the divine Son of God can grieve.
That's right.
He knew he was about to work a miracle to raise Lazarus, but he still grieved because it's okay to grieve at him.
And that's an excellent scripture I use a lot. Because we think that Jesus he didn't go through any of this stuff. But he did. He grieved, he cried, he got angry, righteous indignation, but still, and he processed it out.
I heard you just kind of say, that you kind of, how you said it to yourself, like, well, what would David want me to do? He would want me to go do this, How would you see, like, that being used as, from, like, a counselor's point of view of
And a negative.
Like saying it, but then there's a negative way, because I've also heard that used as like kind of like a shaming technique almost. Like, well, what would that person have to say about, you know, this behavior, or how you feel about this? How would that person, you know, did you
When I'm working with people, it's with a healthy focus, and it's not based on some opinion that a person said to you, but we're really dealing with your grief in a healthy way. So we're looking at it through that lens.
So is that like pretty, like, obviously, I mean, I feel like it's unhealthy.
It is unhealthy.
Okay.
Yeah.
But, I mean,
Like, for instance, if you lost a spouse or a love relationship with a boyfriend or something, and there was a sufficient time for you to grieve, and you got into another relationship, and everybody in your family said, oh my God, do you see she's with blah blah over there? You know, you have to be in a place where you feel that you're able to move on. But you know, then when I'm processing, I said, should you never be with anybody again? Is that what this is about? So I'm walking them through the fact of, one of my clients now, husband died 4 years ago, and she's in a pretty intense relationship, but she's holding herself back because she feels like her husband she should still be in love with her husband. And I said, of course you're still going to love your husband. That doesn't mean that you can't go on to another relationship. And so it's just schooling people on what healthy thinking and healthy speak is, you know, not to stay stuck in this place because the other person. Go ahead.
Okay, so like, say if like your dad like died, and then you're going through maybe a rough patch, right? You got, and then they were like, what would your dad say? Seeing you out there, like, you know, it's kind of almost like shame, you know, like, well, you know, I'm struggling right now. That's why I'm going, you know. But they're using your dad to, you know, like.
Exactly, in a negative way.
Yeah, and you're just like, well, now I can shut off to you. I need to get right.
And that's good for you, because people do that. Family members and people can say some pretty egregious things when you're going through something. So you really have to be, I'm sorry?
They may have good intentions.
They may have. But if it's damaging to you and hurtful to you, and you're able to tell them, you should tell them. You know, I'm not accepting that. My thinking tells me that if you're doing healthy stuff now, if you're not doing healthy stuff,
that was an example.
yeah. But you know, I'm taking care of myself. I'm doing healthy things. I prayed about it. I feel good about where I'm at, and I feel like I need to move on at this point. So that there's the healthy and there's the negative, because people have a tendency to. I've seen it before. This lady's now dating, and her whole family thinks she's horrible because they say she should. 4 years later, they're telling her it's too soon to be. 4 years later, they're telling her she has no business. And I said, you know, you have to find your healthy place and do what you feel is healthy for you, not always listening to other people, what they have to say. Because people are, you know how people are. If they can say something negative, they're going to say something negative. This is how we are. So it's definitely.
Guy, married. I mean, his wife died
2 days ago.
He married again. Really?
So, you know, you have to put people's comments and stuff in perspective for yourself. Yep.
Something like that for somebody's spouses. It's real. Is it like if they start dating like 2 months, and I had said that to my friend, I was like, it's too soon. She goes, why? They were like, I don't know, it's too soon. But I think
That's a good point.
Thinking it is that people will make a judgment on that, and they'll be saying, so soon, you didn't love him, why she's still out there, why she was dating already. I thought maybe because she was still grieving, and that was just a mask or a bandage.
Could have been.
But I was just like.
But the reality is we don't know.
Yeah, we don't know. Everybody's different, so maybe.
Not only is everybody different, everybody's relationship's not what you think it is. Sometimes you can be in a pretty messed up marriage. Not that you're happy that your spouse died,
Yeah,
not really.
just
But you're like, that's over with. You know, I mean, so we don't always know.
There's also studies that show that you actually remarry faster if you've had a loving, healthy relationship because you want that again.
Right, exactly.
You know, if your experience of marriage was really positive, widowers do this a lot. You know, if they lose their wives. It's really hard for men to stay single when they're old because their spouses, their main
Right.
support.
You've got that bond.
And there are an awful lot of widowed ladies out there, so it's really good. Go out and find a new wife. And it's not a replacement, it's just I loved being married and I still want to be married.
That point that you said is not a replacement. It is not a replacement. We can love more than one person in our lifetimes. You know, it's where you are in your head with this whole thing. And so I think we should really, you know, the statement I made before, we talk too much. We're in other people's business too much. You know, we pass judgment on people too quickly. You know, we look at something and we immediately make a judgment call on it. And we really need to get better about that. We don't always have to say something. The worst thing people did for me when my son died was have to feel like they had to say something to me. You don't have to say anything to, I really don't want to hear that. And so sometimes I just wanted to sit with somebody. Not because I wanted them to talk to me, I just wanted to sit with someone. So being in tune with the people around you has a lot to do with it too. Sometimes we just shouldn't say some of the things we say. So the benchmark of completed grief reaction, when the person can think about the loss without severe emotional, physical, and psychological pain. That's when I knew that I was able to move on after my son died. Because I pushed in it, I felt the pain. It was a couple years later, the homeless lady walked up to me who didn't know me from Adam. And God has his way through many avenues of getting us to come back to reality. And that was my invitation from him. All right, Michelle, it's enough of this. So let's get back to reality. And that's how God does. He puts all of us in each other's lives. I'm not here by mistake. It didn't come to me to be here because I love the Lewises, but there's a reason for me to be here. If we look at life like that, you don't just run into people. You experience what you experience for a purpose and a reason, in the hills and the valleys.
I just wanted to say, Michelle, I like that because I think that's right on point. That's what Alvin and I learned about the death of our twin. I had twins. And one of the main things that we learned that got us through was the Lord Jesus showed us so clearly that her death had a purpose. It wasn't frivolous. And not only that, but because you carry for 9 months and then she dies, it sets them, you know, that's a beyond understanding type of thing.
Right.
But we saw that not only did her life have a purpose then, but still does, but our suffering that he allowed to come through his fingers, which we had to get to that point, has had and continues to have a purpose. It's not just out there and there's no purpose or reason why there's this pain. I think that was part of our, that was a major part of the healing for
Sure.
us. And allowing the Lord to get us to that point of realizing I'm the creator of life. I give it and I take it away, but I have a purpose for it, which caused us to grow in our understanding of God's sovereignty over all things.
That's right.
And that was tremendously, continues to be tremendously helpful for me to get to that benchmark. It doesn't erase the
Right.
pain, you know, because his look-alike or her look-alike is in our lives every day.
Mm-hmm.
But it definitely gives us a rock to stand on and to move through.
That's true. Is your journey, my journey was the same. And I'm a stronger person. I would not have done the things that I've done today if it wasn't for, it sounds terrible, the death of my son. It propelled me in another direction. And you know, the other thing that we forget, I don't think we forget, we know, is that we live in a fallen world. A lot of what we experience is at the hands of people that are wrong and negative and doing bad things. You know, if somebody killed my child, God, why did you allow this? Is what a lot of people will tell me. And I say, this world is fallen, and maybe you don't understand the whole ramifications of that. We have free will, and we don't use it in a positive way. And people will go out here and do horrible things to other people. And that's part of the fall that happened back in the beginning with Adam. You know, the rug got pulled from underneath us. Whether we like it or not, people will say, why are we paying for what Adam I hear all kind of stuff. But this is where we are today. This is the world in which we live. God is alive and well. He's sovereign. And no matter what we go through, he's going to work it out. That's what I know. I don't care what pain you're going through. God's going to work it out some kind of way. And you just have to know that and believe it. So I lost my screen. So, trauma treatment. You can go to the next screen. I think there's a video if you hover over that person's head. Yep, there's a. So I'm gonna. That's okay, because I can talk through this. It's not a big. I mean, I'm gonna let him. He usually gets it up. I cannot locate the internet server or proxy server. That's not good.
That's not good.
So.
Keep talking.
Let me get my slides up to where, because he was doing such an awesome job. I didn't even put my slides up to where we are. So trauma treatment is huge. And we're still learning every day of ways to treat trauma. So I'll go through some stuff, but it's by no means all the things that are available for trauma. The number one way of treating trauma as we grow, but this has got a history to it, is EMDR. That's the number one clinical way of treating trauma. And that's where eye movement, desensitization, and reprocessing is all about. And that's simply a right brain, left brain when you're following my finger. And it's allowing you to access both parts of your brains. To be honest with you, they don't really know why it works. They just know it does work. And have you ever heard of tapping? That's another derivative of EMDR, where you're tapping your knees or you're tapping up here. There's several new ways of branching off from EMDR. I'm not all that, I can't sit here and say, well, yeah, that works great, because they're so new. We don't really have, there haven't been enough clinical trials done of them where we can actually say, this is a tried and true, clinically tested way of helping people. But they're out there and people are using them. Go ahead.
So how long is a session for EMDR?
It's 90 minutes, and it can go on for however long it takes for the person to process out their traumatic experiences.
Is there anything else that accompanies it, like music, or is it just complete silence, or like if you're?
Well, I'm talking to you, and as you're accessing your trauma, I'm asking you questions about it.
Okay.
And then I'm helping you to reprocess your trauma. And when I know that you have, or believe that you have processed through that piece, we'll go to the next. See, a lot of trauma is tied to other traumas. Or a lot of trauma has different, it's like an octopus, it has other arms to it. And when we deal with one part of your trauma, it'll open the door to another part of that trauma. And so I could be sitting in several sessions with you just to go through that first trauma that you went through. So this could be, it can be a one-shot deal, or it can be a mini-shot deal. Does that make sense? But that, go ahead.
So what is processing? What is that actually? You say we're processing, just talking about it makes it process?
You're following my finger. You're accessing right and left brain, which then accesses the unconscious, this is what we think because we don't know for sure, the unconscious part of your mind, which then accesses your trauma, that comes up. And that's why I can't do, I'm still learning EMDR, and I can't do it with all my clients because everybody doesn't have the ability to be able to tolerate it. If you tell me that you have heart issues and certain things, I won't do EMDR because not only could I re-traumatize you, I could also cause further problems in you physically. So I have to do thorough history before I start with people. So everybody's not a candidate. People get mad about that sometimes, but I'm not going to do somebody that I know can potentially harm them. And that's how I am. I'm not going to, you may come to me and tell me you've been going through this your entire life and you heard about EMDR and you want to go through it, but it's not that simple. It's not just because you want it. It's because I'm able to, and you're capable of handling the process that we would go through with EMDR. And everybody's not able to do that. EM.
Oh, EM.
eye movement, desensitization, and reprocessing, yes. And for me, it's an intensive study. I mean, I've had to go to several workshops. I have several more workshops to go through. We practice on each other. We practice on other people. And even after I'm finished getting certified, I still have to check back with my supervisor about how I'm doing with other people. And so it's a very intensive type of a therapy, and understandably so, because I'm accessing those parts of your brain that you've shut down to.
Do you find in your experiences with that, like reenactments taking place, like even though you're asking the person a question, they may become the abuser in your, like they may not be able to verbally express what it is.
They don't become my most profound person scared the life out of me. She went to her crib, which is where her first incident happened, and she started climbing up the wall. Wow. And I had to bring her back because it scared me. It's like, oh my God. But she came out of it and she's like, God, Michelle, that was great. Thank you for, I'm like, oh my God, I'm glad that you did.
So it's almost like a deep state of hypnosis.
It could be, but I don't go with that, because some people say, are you going to hypnotize me? That's not our intent as therapy. That's not what the terminology is that we use. Could you be in a state of hypnotic? I guess you could. She said that I asked her to explain to me where she was. She said, I actually went back to my crib in the day that my father was beating me. And it was just that her face was contorted and she literally was climbing up the wall, I know, on her back. And I just wasn't expecting that. So I brought her back. I did other sessions with her. She was able to, but that particular time was, oh my God.
How do you bring them back? Do you like,
I told her to listen to my voice. And she started calming down. I said, and you never get loud and you never do this. That is like totally not right. You tell people you have to be the calm presence. And I maintain a connection with her the whole time. And I said, listen to me, come back to my voice. And she did. And she came down and she thought it was the greatest thing since sliced bread. I was like, well, that's wonderful if you think that. This is a video on neuroplasticity.
Not so long ago, many scientists believed that the brain did not change after childhood, that it was hardwired and fixed by the time we became adults. But recent advances in only the last decade now tell us that this is simply not true. The brain can and does change throughout our lives. It is adaptable, like plastic. Hence neuroscientists call this neuroplasticity. How does neuroplasticity work? If you think of your brain as a dynamic, connected power grid, there are billions of pathways or roads lighting up every time you think, feel, or do something. Some of these roads are well traveled. These are our habits, our established ways of thinking, feeling, and doing. Every time we think in a certain way, practice a particular task, or feel a specific emotion, we strengthen this road. It becomes easier for our brains to travel this pathway. Say we think about something differently, learn a new task, or choose a different emotion. We start carving out a new road. If we keep traveling that road, our brains begin to use this pathway more, and this new way of thinking, feeling, or doing becomes second nature. The old pathway gets used less and weakens. This process of rewiring your brain by forming new connections and weakening old ones is neuroplasticity in action. The good news is that we all have the ability to learn and change by rewiring our brains. If you have ever changed a bad habit or thought about something differently, you have carved a new pathway in your brain and experienced neuroplasticity firsthand. With repeated and directed attention towards your desired change, you can rewire your brain.
That's just really helpful to me. And I let my clients see this because they think that I think like this, I'm never going to change, my brain's always going to be, and it's not true. Does it take time? Sure it does. Anything that we do, any kind of change takes time. And sometimes a little longer for other people, depending on how long they've been in the trauma, how long the patterns have been set. But everybody can change. You just have to know and believe that. And Our Bibles tell us that. What would happen if we didn't transform in this process of walking this Christian walk? We are in the process of constantly transforming ourselves through the love of Christ, through the love of other Christian brothers and sisters, through our reading of the Bible, through our studying the Bible, and our meditating and praying on the Bible. These are all things that are changing that sinful nature, which will never go away, but we can work on it. It changes that. And so a lot of times I'll go with that with my Christian clients, that yes, we can change, and we have the ability to change how we think. Did you all have any? Yep.
What would you say about somatic body healing and just introducing working with one's body to heal trauma? I know that's kind of a new form of therapy, but just getting back into your body. I can dissociate a lot, but like I do yoga and I can get back into my body. Yoga helps me out a lot. I have read about somatic body healing and people re-entering their bodies and doing exercises that bring them back to that conscious awareness.
The concept is good. I haven't read a lot about it because it's really new. But I'm skeptical about anything that's really new. I feel like it needs to be, even though it could, like tapping, it's based on EMDR, but I still am not bought and sold in it just because you're telling me it follows the patterns of tapping. So I'd have to learn more about somatic processing or reprocessing in order to feel comfortable about it. My clients come to me with this stuff all the time. Well, Michelle, have you heard about the new blah, blah? And I'll say, unless I've studied it and feel comfortable and can get a validity about it, I'm not gonna go with it. Because it may be wonderful, but I don't want my client to be the guinea pig, you know, and find out it worked, it didn't work, or I should have never been doing it with them at all. So I have a tendency to go with stuff that I know is tried and true, pretty well practiced for healing. Go ahead.
My youngest was diagnosed antisocial personality disorder, narcissism. So.
Well, who was this?
My youngest, and so then typically that's not a very good diagnosis.
No.
And so I read a book called Rethinking Narcissism, and like we're all narcissists to some degree. And how about things like that, where traditionally people have said, because after I read that book, he's not like way over here, he's like a habitual narcissist, So can you work with that?
So most all mental illnesses are on a spectrum. So even when I'm diagnosing with DSM-5, you may hit some of the marks, but not all of them. And so I'm very reluctant to categorize and stick people in. And when you say narcissistic, you are a narcissistic personality disorder. That to me is very detrimental, because people take that and they're like, oh my God, I will never be able to get along in society. I'm always going to be this quirky person. So I'm careful about, if I have clients that are diagnosed with narcissism, antisocial, I have to decide whether I'm going to tell them or not, or how I'm going to tell them, because a lot of times in their head, that's what they are, and they are to the extreme. So if I tell you, you diagnosed with the narcissistic personality disorder, and immediately in your head, these things are popping up. I'm not going to be able to be in society. I'm going to start seeing people. I'm going to hear voices, and that's not good either. So once I feel like I've diagnosed somebody with something, I'm working with them through it, and at some point I may or may not tell them, depending on what it is that they have and whether I feel where they are on the spectrum with that thing. If they get an understanding and are good with mental illness, it's fine, but a lot of my clients aren't. You tell them they got something and that's it, they're gone. Yeah, I'm a this now, and that's what their identity is, and I don't want to do that, because like you said, you can have, and you have to be careful with people that are diagnosing. You can have narcissistic tendencies, but not be a narcissistic personality disorder. And so you have to be careful with that. When you start calling people those things, that's some serious stuff.
Are you ever surprised, and you've been practicing a long time, are you able, without even doing the DSM-5, tell?
For some of the diagnosis that I see, I have lots of bipolars, a lot of depressive disorders. I don't have an extreme lot of but I can Some of them I can spot just immediately, but I'm careful about that too.
Are you ever surprised, like after you, so maybe you had like this preconceived notion, and then after you went through the
Yep.
DSM-5, you're like, oh, they're not this, they're that.
Not after I went after the DSM-5, once I really got to know my client.
Oh, okay.
So they can present a certain way initially,
Okay.
but then as I get to know them and talk to them, I find out that there are levels and nuances to whatever they're struggling with. So that's why when you diagnose with these extreme personality disorders, that's very damaging. So I'm careful about that, very careful. And I'll reveal, when I'm talking with people, it's not that I don't tell them what I see. I tell them and we talk about it. I don't just lay it out in front. Well, you are now a narcissistic personality disorder, you know. And I learned that because I made mistakes when I first started practicing and told people things I shouldn't have. So now, even though they diagnose that way, I'm very careful about that. I don't just come right out with, this is what you are. And I work with them through it. I don't know if I answered your question or not. I was talking to her. Because I'm just careful, and especially with young people, I'm very careful about that. You start doing this, you're a narcissist, you're a sociopath, that stuff is heavy. And that marks people. And I just don't think you should, unless you absolutely know beyond a shadow of a doubt that this person is solidly this, you shouldn't tell them that. So I don't know if I answered your question, but I just think you should take care when you're diagnosing people. Anybody should. I don't care if it's a psychiatrist or me or anybody else. You should take care when you diagnose people. Make sense? Any other questions? So we're going to talk about some of the other therapies. So there's exposure therapy, which EMDR is part of that. So exposure therapies are in essence taking you back to your trauma, exposing you. Some of these therapies will be like, if I had a trauma where my plane went down and I barely survived and I saw these people burn up, and I tell you, I'm never going to get on a plane again in my entire life because of exposure therapy in different ways gradually introduces you back to your traumatic event or traumatic situation little by little so that you can function, get on the plane again, or do some things like that again, because in your head, you know, your body goes into this freeze mode. You're going to pass out if I get close to a plane. So it's little by little exposing you to whatever that huge thing is that you are scared of. Does that make sense? Cognitive behavioral therapy, CBT or DBT, dialectic behavioral therapy, which really was made for personality disorders but has been useful with trauma, is working on the brain, changing the way you think. Cognitive thinking, the way my behavior is traced back to the way that I think. Remember that slide with the little circles? My thoughts produce this, produces that. So everything in my head produces ultimately a behavior. And so cognitive behavioral therapy and DBT. DBT is just words like wise man, and it's different word acronyms that mean certain things. So each of the acronym letters mean something. And it's just an easier way of you remembering some of the things you're taught in DBT and CBT. How to be in the middle and not be on the extreme. So a lot of times I have people that they're way over here or they're way over here. They don't know how to be in the middle. I'm either, something happens and I'm reacting, or I'm over here and something happens and I'm like, that really happened? So we try to bring them, this is an example, we try to bring them to the middle in examining their thinking. And there's worksheets in your book, or a worksheet in your book that shows you how to process, I don't know do I have it? Let me hold it up. How to process your thinking. Yeah, it's this one. We use this in DB and CBT all the time. Perspective talking. It's got columns, and it'll ask you for a situation that bothered you, how you responded to it, what's your interpretation of how you responded, and what's an alternative viewpoint of how to respond to that situation. I use worksheets like this all the time with my clients. In fact, I have several workbooks that I work through with my clients. One of my clients came back and said, isn't it saying the same thing over and over again? And I said, yeah, but we're trying to help you change your thinking. You don't just hit the sheet once and then voila, it's done. So it is presented in DBT and CBT certain ways to try to get you to change your thinking. Let me see if there's another one in here. And there's prompts for challenging negative thinking. This is another CBT worksheet. So it tells you, am I confusing a fact with my opinion? What's the evidence for the negative thought? Are those thoughts helpful to me? If a good friend knew I was having this thought, what would they say to me? So these are some CBT type things. And they're taking collectively. So I pulled some things out for you, but that's not all I use for my clients. It's some of the stuff I use for my clients. It's an example of CBT. I didn't pull any DBT worksheets out, but they go along the same lines as CBT worksheets do.
What's DBT stand for?
Dialectic behavioral therapy. But it's all brain stuff. You're working on the head. So you asked me about EMDR. There's a sheet that talks all about EMDR in your book. It tells you how we do it, why it works. It even gives you the eyeballs and the movement and stuff. Yeah. And then this is one so I know you all have heard of mindfulness. I'm pretty sure everybody's heard about that. So we make this big deal out of mindfulness like it's some big mystery. It's not a mystery. It's focusing your head on something else. Mindfulness is simply sitting somewhere. This is how I start my people with looking at your hands and totally getting into your hand. And it sounds silly, but your whole focus is you're explaining the lines on your hand, how many lines are there, the color of your skin, are your fingertips pink or are they white? Do you get what I'm saying? It's taking your head, refocusing about what's going on here and just honing in on one thing. Because people get so caught up in mindfulness where they can't do it. I can't do that. They told me I had to do it. It's not. I try to make it really simple. I'll ask my client to like sweet. What do you like least, sweet or sour? If one of my clients said, I hate sour things, then get yourself some lemon balls. And when you're going through a really traumatic period, pop that lemon ball in your mouth and your body's going to react to it. It's going to say, what in the world? Your taste buds are going to react to it, and it's going to divert your attention off of your pain and put it back on that lemon ball. These are all things that I'm working with people. It's not, I don't do any one of them one time. I do lots of stuff lots of times. And I'm teaching people how to do them for themselves because you're not with me every day. So when you're not with me, I'm showing you things to do to help yourself when you're not with me. So you're building your toolbox, your therapeutic toolbox up. Progressive muscle relaxation, excellent thing to do. Yoga, excellent thing to do. Meditation, be careful you're meditating on scripture because you can open the door to other things. I meditate, but I meditate on scripture. And God always gives me profound messages when I'm meditating on the scripture. And so this is another one. Relaxed breathing is huge. I'm so trained in relaxed breathing now that when I start, my body automatically starts going into a relaxed mode. And this is medically true, that when we start doing this breathing, it affects certain parts of our bodies and causes us to relax. So it's not just me telling you this is what we know works. What else do I have in here? So I went from the clinical part to the holistic mental health. Scriptural, a lot of the stuff you all already said. Scriptural reading, faith-based meditation, anything focused on your Bible and Bible learning and Bible study is a healing process. And then we go to the cleansing of our bodies. Sharon probably can talk about this better than I could. Eliminating food additives, sugar, processed foods, etc., because all that stuff clogs our minds up, our bodies up. You know, I'm a sugar addict. And I can tell you when I cleanse my body and I go back to it, I feel terrible. Inflammation increases in my body. The increase of inflammation is bad, and it causes all kind of other problems inside your body. So some of this is healing from the top down, bottom up, however you want to look at it. Healing your nutritional deficiencies, hormone imbalances, etc. I was talking to, I can't remember your name over at this table. Erica. Erica. I have had for 20 plus years an iron and a D3 deficiency in my body, which caused major issues. And I'm a very outgoing, peppy person, and I was dragging various times in my life until I met a doctor who said, you need to get an iron infusion and you need to get these special D drops, which totally changed my life. Those two little simple things turned everything around for me. But it's learning that. Sometimes we're limping around and we don't know that we're limping around, you know, because it just didn't come to us that maybe I need to get this checked or maybe that's low. So all these things are things we need to stay on top of to keep ourselves healthy, mentally and physically, because this affects this and this affects this. So it's a, and I don't think there's anything after this. Wow. So we got through it. Woo-hoo! Thank you all.
Thank you.
Thank you all. I'm telling you, I learn more from people than I do. God brings people into my life. God is always in my life. And I learn all the time. I really enjoy being around people and sharing people's pains and their happiness and all of that, because that's all about being God's children. We will go through these things, and we are supposed to be supporting each other. So thank you for your attention and your questions and everything. Yeah.
We're going to close in prayer, and I guess we'll be here for a few minutes as we're cleaning up. So if you have any other questions for Michelle, please do. But let's close in prayer. Father, we're grateful that we come to you, those who are walking through the valley of the shadow of death. Yet we don't have to fear evil because you are with us. Your rod and your staff, you comfort us. And yet you do tell us to mourn with those who mourn, and that we should bear our burdens with one another. So help us to do that. Help us to be present so that we can mourn with those who mourn and be true burden bearers. Thank you for Sister Michelle. Continue to bless her in this ministry she has to your people and to those who have yet come to know you. We thank you in Jesus' name. Amen.
Amen.
Thank you all for coming. I appreciate it. Thank you. Amen.